Community health is everywhere and anywhere, which is what's really exciting about it, because we all constantly live in it, but we're also influencing it daily. And so community health is the environment in which we live that helps us either enable specific healthy outcomes that we want or inhibits us from achieving those. And so a good example of that is having fresh fruits and vegetables at our local grocery stores, having the ability to walk in our neighborhoods because there's built sidewalks, but also a feeling of safety. Having social support through our friends and family is an aspect of community health. So it really is everywhere that allows us to be our healthiest self. So we've been kind of under renovation is what I call it, and we've had some really fun updates. Probably the biggest update we've had is that we've created 2 elective pathways. We previously only had one where students came in, they took the community health coursework, and then they had to declare a minor, and the minor served as their electives. That option still exists, but it's called the community engagement elective pathway. Our second one that is new is we have the preclinical elective pathway. And so what that one does is increases the inclusivity and accessibility to students who are pre-health, so pre-medicine, pre-physician assistant, pre-dentistry, pre-occupational therapy and nursing. All these pre-health tracks can engage in our major, still take that community health coursework, but instead of doing a minor for their electives, they get to take that dedicated pre-health curriculum to allow them to satisfy their eligibility requirements for their secondary programs that they hope to get into. I said community health is everywhere, and it's a really big part of healthcare. It's the human side of healthcare is how I define it. And so we were seeing that students who are interested in medicine, physician assistant, those kind of clinical services weren't able to engage in our major, and that feels like a really big missed opportunity because it allows for those students to still take their bench sciences, the biology, the chemistry, the part that really recognizes the body. But what's happening, those students didn't have the opportunity to see how the person interacts with their environment once they go home and leave a hospital. And so our program now having that pathway allows them to see a different facet of healthcare and is really complementary to their other studies and also makes them a more competitive candidate for both the workforce if they decide to go directly into the workforce or for any post-secondary degree program. Some of our other updates include that we've introduced 2 new classes within the program. One is an introduction to community health course, which is really great for freshmen and sophomores who may be interested in community health but aren't quite sure. And then our other one, actually we have 3 new courses. Our other one is current issues in community health, so bringing in some of those real world, what's happening around us. So the overturning of Roe v. Wade would be a conversation in that class, and how does that affect our health and our community's health in live action. And then we have a writing fundamentals class because we see that students are out there in the workforce applying for grants and they're writing scientific articles, but we're not really dedicating time in the classroom to that. And so we wanted to put a specific focus. So all that to say, we wanted to kind of inject some currency to it so that students were not only learning about these things and then not seeing how they're applicable in the classroom, but bringing in what's happening to the classroom so they can readily see how it's applicable to their daily living. The ultimate goal is to improve the student experience. Ultimately, we're here to serve students, and we're seeing that community health is of interest to them. It just wasn't necessarily, in terms of how we had structured the program, fitting what they had hoped to do in terms of their professional growth. And so we were willing to be flexible and conform our program structure so that it could fit meeting what they wanted and hitting those kind of holes that we already said were complementary to medicine. That's known. So then why wouldn't we make our program complementary to pre-med students? So things like that allowed ourselves to be conforming and flexible to meet the student experience and what we're seeing kind of in this new student body since we have the recent freshman admit. And so we wanted to increase our ability to cater to what they're hoping to get out of their KU experience. I think one of my big points is, like I said, we are byproducts of community health, but we are simultaneously an influence on community health. So you're already living in part of this. This isn't new to you. We just probably haven't defined it in your previous experience. And so community health is that social determinants of health, the holistic side of healthcare, the human side of healthcare, and you're a part of it. And this is just formalizing that process. I think some other big benefits within the community health program is we do have smaller class sizes, which are really great for getting to know your peers, but also your faculty and instructors, which is kind of a huge leg up later on in your program experience when you're looking for letters of recommendations or looking for internship experiences, which probably hits on my last thing that I would say is a really big benefit about the community health experience. We do have a culminating internship, which gets you boots on the ground experience, which is not only additive in the sense that you get to apply everything you learned within the community health program, but it's something you get to add to your CV. It makes you more competitive in interviews. It makes you regarding the workforce or post-secondary education. And so it just kind of brings in that tying the knot and bow on the program for the student as a whole and lets them leave with a strong resume. So we have a lot of different things that people who graduate with a Bachelor of Community Health do. So we have health educators, which range in settings. So you could be a health educator in a hospital, so teaching patients about nutrition or counseling them in medication adherence. But you could also be a health educator in a K through 12 school setting. So health educators are one. We also have special projects coordinators or program directors in community-based organizations or nonprofits. And a lot of that time that's grant writing and grant implementation for various health outcome projects that are either funded governmentally or within your local organizations. We also have healthcare providers and medical professionals that come from community health backgrounds. And then for those who are interested in research, there's a whole plethora of opportunities within the research domain.